So what we're reporting on today is the results of treatment with ALK4290 in patients with treatment-resistant neovascular age-related macular degeneration. The current standard of care is intravitreal anti-VEGF injections for patients with choroidal neovascularization due to neovascular AMD. And though most patients respond well to therapy, there's a significant minority of patients who don't do well either morphologically or functionally. So an additional therapy that's either incremental to or in place of anti-VEGF therapy in this difficult to treat patients would be advantageous. So this was a phase 2A trial performed in Hungary and Poland on patients who had treatment-resistant neovascular AMD. 26 patients were enrolled in the trial, 24 patients were to completion. Entrance criteria were standard for neovascular AMD trials, but patients were required to have received at least 3 anti-VEGF injections, and the last one had to be between 30 and 90 days prior to the screening visit. So patients that were enrolled in the trial were typical of patients with neovascular AMD in terms of their demographics. And what we found with the results was with 6 weeks of ALK4290 monotherapy, the mean best corrected visual acuity was a +2 letters, and 72% of patients had stable or improved visual acuity by the 6-week endpoint. We found that central subfield thickness of the macula did not change significantly over the 6-week period, but interestingly, after treatment was stopped, over the 4-week follow-up period, central subfield thickness increased significantly, suggesting that withdrawal of therapy actually worsened the disease. Secondly, the retinal pigment epithelial detachment height did not change significantly throughout the trial, which actually was a little bit different because in the 2A trial of treatment-naive patients, pigment epithelial detachment height decreased significantly while on therapy. Patients tolerated the drug well. There were very few systemic or ocular adverse events, and no patients discontinued the trial because of serious adverse events. And so what we found with this molecule is that we found that in patients with treatment-naive disease in a previous 2A trial, the visual acuity improved by 7 letters, which is actually quite impressive at 6 weeks, and that was with monotherapy. In that trial, 83% of patients improved or had stable visual acuity, and 21% improved by at least 3 lines. And in the study we reported today on patients who failed anti-VEGF therapy, we found an improvement of 2 letters at 6 weeks with monotherapy. Again, a reasonable signal for therapeutic effect that deserves further evaluation. So what we're looking at down the road is trying to further develop this molecule for use as monotherapy or potentially as a supplemental therapy to anti-VEGF therapy. And the advantages are oral therapy as opposed to intravitreal injections, so that patients can be treated at home, to decrease the need for visits to the office, and decrease the backlog of patients that are clogging up retinal physicians' offices, and to decrease the current reliance on regular, repeated anti-VEGF therapy. So this may be, if it works well, the first oral therapy for age-related macular degeneration.